Next, we have Dr. Nupur Garg. She is a dual board certified practicing lifestyle medicine physician with a clinic called Lifestyle and Family Medicine near New Haven, Connecticut. She completed her undergraduate education at MIT, went to Yale for med school, and did her residency at Mount Sinai in New York City. She has won numerous awards in research, entrepreneurship, and community building, and she lives with her husband and two young children. Welcome, Dr. Nupur.
Thank you. Thank you so much for having me. And thank you to Chef AJ. And also I want to thank Shilpi, Dr. Pradhan as well for organizing this whole project. And thank you, Dr. Malhotra, for helping to organize this. It's truly a privilege. I have enjoyed listening to my colleagues, my co-authors over the last few days. And one thing that really struck me was I noticed that so many of our stories towards lifestyle medicine began long before we even knew about it in the first place. And that tells me that I believe like we all had an inkling that there was something more to the story than we learned in medical school. And we all felt like maybe there was something missing, and we all may have found it. And it was really thanks to, first of all, Shilpi for having us participate in this book to share our stories. And it was really cathartic for myself, and I'm sure a lot of other co-authors. And then thank you, Chef AJ, for letting us share it with everyone, our exciting experience of kind of finding that missing piece in healthcare for a lot of us and really fulfilling so much of what we intended to do as clinicians in the first place. So thank you. Today, I'm going to paraphrase bits of my chapter and to tell you a little bit about my story. So my story begins in ancient India. I've always been quite curious about age-old traditions rooted in health and wellness that were preserved over millennia in an almost prescriptive fashion, begging to be challenged by every new generation, and yet they sustained even modern day globalization. And now customs like yoga and meditation have been studied numerous times and shown to be beneficial. And Indian culture is not unique. Millennial old customs that have been studied and found to be beneficial can be found in almost all corners of the world. And the differences among them are equally as interesting as their overlap. So for me, even though I found that interesting, I am a naturally skeptical and analytical person. So even though I loved to learn about the various cultural health and wellness customs, if I was going to change, I needed a little bit of evidence. And it wasn't until my son was born and started eating solids that I decided to research what evidence even existed in nutrition. And this was well after medical school. I hadn't learned that. And not thinking I would find anything, I was shocked to learn about the entire field of lifestyle medicine. And I was immediately drawn to it. And since then, lifestyle medicine has helped me fulfill so many of my goals, not only as a mother, but also in personal health and also my career goals. And I think you've heard a lot from my co-authors and my colleagues about their amazing personal health journeys and the journeys they've taken with their patients and their communities. I wanted to focus on how lifestyle medicine helped me achieve my career goals and my time with you. And so the first thing was I changed my entire practice of medicine to be lifestyle medicine centered. I am a board certified emergency physician, and I first started practicing lifestyle medicine with my patients in the emergency department. And I know I've heard Chef AJ speak about kind of that moment where you realize that things have to change. It's like that trigger moment. We do learn about that in lifestyle medicine as well. It's a great time to capture a captive audience already about what they can be doing to sort of like prevent them ending up in the emergency department with whether it's a heart attack or a fracture or what have you. And um, and basically that becomes the impetus for change. And I started looking for those, and patients were ready to hear that. Before I did my certification in lifestyle medicine, I didn't have the tools to educate them. And afterwards, it was like night and day. I had a completely different relationship with my patients, and they loved it and they wanted more. I would stay late after my shifts and just try to educate people about ways they can stop losing their kidney function or ways they can start improving their heart function and things like that. Um, they I wanted my patients would ask me, "Do you have your own practice?" I didn't, obviously. I did try to start a clinic at the institution I was working with at the time, but they were moving too slowly for me, and so I opened up my own practice modeled after Dr. Dysinger's practice, like you had mentioned, and people were coming. They really are looking for this. Asking people to change their lifestyle is not an easy task, but people were listening to me, and I didn't know exactly why, but I can kind of put my finger on how my personality was just like the perfect fit for this profession. And that's why I got so much satisfaction out of this career choice. But basically, I for one, I always ask the patient what their health goals are, and I give my recommendations based entirely on those health goals. It's not what their mother wants for them, it's not what I want for them, it's not what the national guidelines say a certain lab value is. Like, a patient is not a lab value. It's what they want out of their health. And I see myself as sort of their health consultant that bridges the gap between them and achieving their health goals with, and the gap is the medical education they need to sort of make that happen. And I do my best for each individual. It's not a one size fits all. And the second thing is I naturally never believed in the paternalism of the physician-patient relationship. I almost never had like non-compliance in my verbiage when I discussed patients or leaving against medical advice. I kind of didn't like those terms because it kind of means like, well, the patient's being bad because they're not listening to me, but it's they're making a choice and you have to align with their goals for their health in a way that they trust you about the choices that they're making. And then you will find that their choices align with yours. And so patients come to me, they say, I will never give up meat. And I say to them, I will never ask you to give up meat. I will just educate you according to your health goals with where you want to be. And then next thing you know, they're texting me, it's been like 76 days since I ate meat. And it's not something I ever asked of them. I just educated about what they're doing that could harm them, what their health goals are, what they need to be doing differently if they do want to change, a certain lifestyle, what they can be doing, giving them resources and tools. And that's kind of what I like to do. And I find that fits with how I want to treat patients much better than what I was doing before, which felt a little bit more, I don't know, just different than what I would have liked based on my personality. And the last thing is that I myself am going through a lifestyle medicine journey for myself, putting myself on my own action plans, quitting sugar, which is like one of the hardest things I've done. And I can empathize with my patients differently and better. And I share my journeys with them. I also treat certain foods like addictions, like you mentioned, Chef AJ, in the past. And I think that really helps with people because they know that it gives them extra tools to rely on. So we set quit dates, we have relapse plans, we have support systems, we have, timelines. And then I've even connected one patient with another patient as their sponsor, and that was something new. So I've really enjoyed just this whole different framework of thinking about when a patient is being asked to change, what that actually means, and really not targeting any specific personal goals, but whatever they want. And so that's been my practice change. But aside from that, I've had other career aspirations. I've always wanted to be an author. And so through this book, and also another lifestyle medicine book I wrote that was geared towards helping physicians pass the lifestyle medicine boards, I was able to achieve that personal goal of mine. And I've always wanted to have a health tech startup. Coming from MIT and being really analytical, and I'll just having the experience of using all the painful systems that we have to use in our day to day, and sort of being forced to use those things and knowing that they're not designed for the user experience. I've always just thought I wanted to do something better and add something that's just better to the the health tech environment. And it's not easy to do. I've tried before I even knew about lifestyle medicine, that was something I had tried. But now through lifestyle medicine, I have had my most viable idea yet, which I'm super excited about. And I think it will help a lot of people. So overall, it has been a very huge privilege of mine to be among my colleagues and co-authors who can call themselves lifestyle medicine physicians. And I really appreciate the opportunity you gave us today to share our stories and hopefully help more people learn about this field and learn about ways that they can improve their health and nutrition and wellness and achieve their health goals. So thank you.
Oh, thank you. Where do you practice, and do you see patients virtually, in person, both?
I do. So I practice in North Haven, Connecticut. It's just 10 minutes north of New Haven. And I see patients, I have all the ways. I love to see patients in person, but I will also obviously see patients anywhere virtually. And everything is able to be booked online on my website, lifestyleandfamilymedicine.com. And it will automatically come with virtual links for anyone who needs that.
Nice. And what are your socials?
So I have Instagram at CT Lifestyle MD, similar Facebook, CT Lifestyle MD is my practice one. And then I also have Twitter at Garg MD. And is there more? LinkedIn? I don't know, Garg MD as well. So similar themes. You can pretty much find me if you Google me as well. Um, but I'm so bad at social media and advertising myself. So that's another reason I appreciate this opportunity. Thank you.
When you said, you say to the patient that says, I'll never give up meat, I'll never ask you. But what if that, like, okay, so for example, say you were a pulmonary doctor and the patient had lung cancer. You say, well, I'm never going to give up cigarettes. How do you, I mean, does a doctor ever say, well, you've got to give this up to get better?
There are different approaches for different patients. And I think when a patient is coming already with that sort of defensiveness mentality, then it's not the right time to sort of like, show your upper, like your, whatever it is, like you're the person in charge and you're the one that gets to say what they have to do. And it's sort of like more of an investigatory endeavor that I take about what have they tried before? Have they ever thought about it in the past? What are some of the mistrust or distrust kind of ideas that they have about that? If there is something that I can clarify educationally, I have a whiteboard right behind my desk. And I just draw out sort of like what is going on with them pathophysiologically without any sort of like goal in mind other than just to educate them and make it make sense for them in a way that probably no one has yet. And so I don't find so much resistance once I have shared everything I know about something with another person, and then they're telling me that their goal is to not have a recurrence of cancer. Well, let me share that with you. Like, what do I know about that? And then you decide what you can do. And I tell them the studies, obviously, if it comes to that. But I don't start with that. I sort of, because I think, again, like if somebody's coming with that much passion against some kind of recommendation that's just standard, like not smoking is like a standard thing, then there's something more there that I just try to investigate, like, and I just try to see where I could help clarify things. But
Nice.
obviously, you have to give them, it's your duty as a physician to give them what they should have, all the tools they need, all the options they have to sort of like meet their goals. So you have to say that if that is what they need to do. And I don't shy away from giving those recommendations. I'm saying if they're, everybody has their vices too, and I allow that. It's like if they can't do something, then I'm like, this is the path that it's going to take you down, and you will have to take a pharmaceutical medication, or you will have to be on a statin, or you will have to do that. And so people they have a right to make those choices.
It sounds like it's very hard to be a doctor.
Well, I think partly though, part of medicine, I think, has been practiced wrong for so long because we've taken this like paternalistic approach where, we're in the white coat and we kind of tell you how it goes. But that it has just shown to prove that that doesn't work. Like that's not how we create lasting change for our patients. And just like we see in coaching, just like we parent our children, just like we talk to our friend, like, before you can influence anyone to change for the positive, you really have to appreciate their model of the world. Like, who is this person? What pain do they have? What pleasure do they want to seek? And really get to understand them as a person holistically. That's why I love palliative care, because really palliative care is like looking at the whole person, understanding their goals and everything in mind, and then taking the next step and putting together the best plan of care for them. And it's just good medicine. And that's how we should all practice medicine. But it's just, I don't think that's how we're taught it, but I also don't think the system allows us to practice medicine that way. So, but I appreciate all the doctors that are here, because as you could hear on repeat, everybody here is saying the same thing, that we meet our patients where they are and help them make baby steps to creating the plant-based diet or the lifestyle changes that they want to make.
I
Yeah.
never thought about that link that you said about palliative care, but it's like that. It's like, you have control at this point, and you need to make a decision based on what all the information that I'm presenting to you. And that's a really, really good, we do put patients in the driver's seat, and they have to choose the path. It can't be from us. Other than if
Absolutely.
you're a pediatrician. I think it's just like maybe, or my next two colleagues can speak more about that.
Yes.